Very good evening. So, dear friends, am I audible? Can you hear me?
Yes, sir.
Okay.
Clear, sir.
So, let's start the class quickly.
Yes, sir.
Okay, thank you. So, today we'll be discussing very important thing. बहुत ही महत्वपूर्ण चीज हम समझने वाले हैं. Because nowadays the people are suffering with the various hormonal problems, endocrine problems, right? So, what is the meaning of endocrine problems? Endocrine problem का अर्थ क्या है? What is the endocrine glands? So, in the human body, there are many endocrine glands. And people are suffering with the problem of the endocrine glands, then they are taking the medicine throughout the life. अगर किसी को भी कोई endocrine glands की प्रॉब्लम हो जाती है, तो उनको औषधि का सेवन जीवन भर करना होता है. So now we are talking about the endocrine glands here. For example, let's talk about the pituitary gland. If we talk about the pituitary glands, and if the person is suffering with the pituitary gland problem, then has to take the medicine throughout the life. Like yesterday we have discussed the pituitary gland secreting TSH or the thyroid hormone, thyroid stimulating hormone, and many other hormones, कई सारे hormone. So once the person suffering with the problem of the pituitary glands has to take the medicine throughout the life, पूरी जिंदगी दवा का सेवन करना होता है. The second, the very important gland that we know, thyroid gland. The thyroid gland secreting many hormones like T3, T4. If the thyroid gland is good, then you are an intelligent person. So thyroid gland is responsible for the intelligence, for growth, for metabolism, right? If the person is having problem with the thyroid, definitely has to take the medicine throughout the life. So the first is pituitary gland, second is thyroid gland. Then if we are coming in the chest cavity, अगर हम छाती में आते हैं, in the chest cavity we have thymus gland. Thymus gland is very important gland and very active till the age of 13-14 years. 13-14 साल की उम्र तक thymus gland बहुत एक्टिव होती है and provide immunity. That's why kids are having better immunity. बच्चों में immunity ज्यादा होती है. बच्चों में immunity ज्यादा क्यों होती है? क्योंकि thymus gland ज्यादा एक्टिव होती है. But definitely after that, thymus gland is becoming inactive, but it is affecting our life even after that also. उसके बाद भी हमारे जीवन को प्रभावित तो करती है. So the thymus gland is the gland who provide immunity, fight with the bacteria virus, and more active till the age of 13-14 means before the puberty. This is also endocrine gland. ये भी हमारी endocrine gland है. Then we talking about the kidney and the cap of the kidney that we know. हमारी kidney की जो cap होती है, that is called adrenal gland. Adrenal gland is also endocrine glands and connected with the many things we already have discussed, and we will discuss again few things. If the person is suffering with the adrenal gland problem, so maybe having high blood pressure throughout the life, and sometimes many other problems like chronic asthma and all. Adrenal gland is the very important gland secreting steroids. ये steroids का निर्माण करती है. So this is also our endocrine gland, right? So pituitary, thyroid, thymus, adrenal gland. Then pancreas. We know the pancreas is very important gland, pancreas. I'm just making like this. So pancreas. Pancreas secreting insulin, and if the person is having problem of pancreas, we know that taking medicine throughout the life. So it means if the person is having any problem which is connected with endocrine glands, has to take the medicine throughout the life. यानी endocrine glands में अगर गड़बड़ी हो जाए तो पूरे जीवन को यह प्रभावित करती है, यानी इसको ठीक करना बड़ा कठिन होता है, बहुत ही कठिन होता है. Then we are coming to the genital parts. In the genital part, we are having testes and ovary. In the female, we have ovaries. In the male, we have testes. So the testes and ovary, they are also endocrine glands. So they are making sex hormones. So these are the endocrine glands. Now, each and every endocrine glands is very much important because we are having 8 extraordinary points. We are having 8 master point, and each and every master point connected with one endocrine gland. हमारा प्रत्येक मास्टर पॉइंट किसी ना किसी एंडोक्राइन ग्लैंड से कनेक्टेड है. If the person is suffering with the problem of any endocrine gland, we can select the point which can treat that specific endocrine gland. So yesterday we were talking about the रेनमाई. कल हम रेनमाई की बात कर रहे थे, रेनमाई और सीबी, कंसेप्शन वेसल और रेनमाई. कल हम बात कर रहे थे. द मास्टर पॉइंट इज लंग 7 and the couple point was kidney 6. We are talking about this, right? For the male, master point will be on the left, and for the female, master point will be on right side. Right? In this way, yesterday we have discussed. Okay. So let us go quickly and see this here. Now look at this very wonderful chart. Now we already know this. Each and every vessels having one opening point on the master point and couple point. Now we'll see the connection with the endocrine glands. अब हम इनका connection देखेंगे हमारी endocrine glands के साथ. So let us see this chart. Wow, this is the chart. Let's see here. So yesterday we were talking about the Renmai. Renmai, the master point is lung 7 and the couple point is kidney 6, having connection with the anterior pituitary. कल हमने बात की थी. कल हमने क्या समझा था? हमने बात की थी कि the Renmai is having connection with the anterior pituitary. And pituitary is having 3 parts: anterior pituitary, posterior pituitary, and intermediate pituitary. Okay, generally we are dividing in 2 parts only, anterior and posterior. So intermediate we are covering with anterior. So we can divide like this: anterior and intermediate in one side, posterior on the other side. So yesterday we were talking about the anterior pituitary having connection with the Renmai. If the person is having problem in the anterior pituitary, we can treat the lung 7 and the kidney 6. Today we will discuss about other also. हम दूसरों की बात भी करेंगे. So let's see here. This is the discussion of yesterday, that anterior pituitary, which is located in the brain, secreting thyroid stimulating hormone, which is working on the thyroid, ACTH hormone, which is working on the adrenal gland, genital hormone, growth hormone, milk secreting, or the prolactin hormone. If you seen yesterday video, then you might be knowing everything. We have discussed everything yesterday, right? Okay. So how to work on anterior pituitary? Why? lung 7 tonification and kidney 6 sedation. For lung 7 tonification, the kidney 6 sedation. And we also have discussed at the stomach 30 for male and CV1 for female. The question comes, why the stomach 30? There are many points, but why you are adding stomach 30? Why not the stomach 31? Why not the stomach 36? Why not the stomach 44? Because stomach 30 is the G cleft point of Renmai. हमारे Renmai का ये G cleft point है. G cleft point is a very wonderful point. They're the medical emergency point. They're very wonderful points. And as soon as you add lung 7, kidney 6, and stomach 30 will be wonderful. And the lots of traffic is passing from the stomach 30. Stomach 30 के पास से बहुत सारा ट्रैफिक पास होता है. अगर आपने स्टमक 30 को एक्टिवेट कर दिया तो पूरे यूट्रस के आसपास की ऊर्जा का स्तर सुधर जाता है. Stomach 30 is removing all the blockages. That's why we are treating Renmai. Renmai is the front channel, lung 7, kidney 6, and stomach 30. Stomach 30 is working very nicely for male, and in the female we are using CV1. Right? But if you ask me about the stomach 30 is the G cleft point of Ren meridian. यही कारण है कि कभी कभी आप देखोगे कि जब हम जानते हैं कि रेन माई क्या होता है. रेन माई यिन का महासागर है. रेन माई इज द ओशियन ऑफ यिन. क्लियर? यू नो दैट रेन माई इज द ओशियन ऑफ यिन. यिन का महासागर है. तो हमने देखा है कि यिन बढ़ाने के लिए हम कई प्रोटोकॉल बनाते हैं. वी आर मेकिंग मेनी प्रोटोकॉल टू इंक्रीज द यिन, लाइक 6666 protocol, many protocol. We can also add stomach 30. Stomach 30 also very good point if you want to add. Okay, there are many points can be added. One point is stomach 30. So lung 7 and kidney 6, stomach 30 combination wonderful for the patient having any problem with the anterior pituitary. Now, very important information I want to pass you. So please, be up to tone. So look at here. Very, very important information. Please look at here. First, you look at this chart, then we'll see that information. So look at here now. So we want to activate Renmai with the lung 7 tonification, kidney 6 sedation, and stomach 30 bilateral. In the female, also lung 7 tonification, kidney 6 sedation, and CV1 bilateral. CV1 will be even, and stomach 30 will also be even method. Now remember one thing. In the future, you will be also learning. Sometime we will be tonifying bilateral, means we are tonifying lung 7, kidney 6 also. But right now, this concept, tone the master point, sedate the couple point, and other point we are doing even method, right? Okay, done. So now, very important information. I told you the pituitary gland is having two parts. One is the anterior pituitary, which is the combination of anterior and intermediate. हमारी anterior pituitary, anterior और intermediate pituitary का combination है. And other is posterior pituitary. Yesterday we have discussed and the anterior pituitary is secreting thyroid stimulating hormone, adrenocorticotrophic hormone or stress hormone, growth hormone, and milk secreting hormone or PRL. ये कल हमने सब समझा था ऑलरेडी. ओके, ऑन जेनेटल हार्मोन FSH LH, तो हम बहुत डिटेल में भी इसकी नहीं जा रहे हैं. What about the anterior pituitary? Anterior pituitary is secreting very important hormone that is called MSH. यही वो हार्मोन है जो हमारी चमड़ी को काला करता है. इट इज गिविंग ब्लैक पिगमेंट टू योर स्किन, टू द स्किन. सो सपोज समवन इज हैविंग व्हाइट स्पॉट और द ल्यूकोडर्मा. किसी को चमड़ी में व्हाइट स्पॉट है और द ल्यूकोडर्मा है, किसी की चमड़ी काली नहीं है. द पर्सन इज नॉट हैविंग ब्लैक स्किन, पर्सन इज हैविंग व्हाइट व्हाइट स्पॉट्स on the skin, that is called leukoderma with leuko white spots. It means MSH. MSH means melanocyte. MSH, a melanocyte stimulating hormone. इसका अर्थ है कि MSH गड़बड़ है, MSH नहीं बन रहा है. MSH का काम है चमड़ी को काला करना, मेलेनिन को जमा करके, melanocyte stimulating hormone. So the person is having problem of skin. Please use lung 7 and the kidney 6. Do not forget lung 7 and kidney 6. Right? So lung 7, the kidney 6 are one of the great point even you can use for the skin problem. Right? That's why if you want to work on the anterior pituitary or the intermediate pituitary, you have to work on Ranmeyer. You fix in your mind Ranmeyer. So in the future, if I want to add one or two more points, there will not be any difficulty because you know, okay, he's suffering with the white spot, Ranmeyer, because connection with the anterior pituitary. Right? Now, regarding the posterior pituitary, अब हम posterior pituitary की भी बात कर लेते हैं. So if we talk about the posterior pituitary, because the entire pituitary gland is very, very important. So if you see the posterior pituitary, look at here, posterior pituitary is connected with the dumai. अब देखो आगे का हो गया Ranmeyer, that is anterior pituitary. The posterior pituitary connect with the dumai, and we know the master point is SI3 and the couple point is urinary bladder 62. And this is the beauty of EOV. Even by 1 or 2 point, you can create the very, very good results by the 2 points only. You are putting the SI3 and the bladder 62 point, and you are activating the posterior pituitary. So regarding the posterior pituitary, so we know this is the pituitary gland, and here we have anterior plus intermediate. And here is the posterior pituitary, which is having only 2 hormone, जिसके पास 2 हार्मोन का सिक्रेशन होता है. One is called love hormone, second is called ADH. What is the other name of love hormone? लव हार्मोन का दूसरा नाम क्या है बताइए? ऑक्सीटोसिन. Oxytocin of the love hormone, which is responsible for the contraction of uterus and breast. यह यूट्रस एंड ब्रेस्ट का कॉन्ट्रैक्शन करता है. दैट इज द लव हार्मोन. ऑक्सीटोसिन secreted by the posterior pituitary. So SI3 activation will enhance the secretion of love hormone. So this is connected with the dumai. Posterior pituitary having connection with the dumai. So we can add SI3 as a master point and urinary bladder 62 as a couple point. You want to work on the oxytocin or you want to work on the ADH. ADH means anti-diuretic hormone, यानी पेशाब को कम कराने वाला. अगर किसी की पेशाब 1.5 लीटर तक होती है तो ठीक है, लेकिन ज्यादा होती है तो गड़बड़ है. द पर्सन शुड यूरिनेट नियर अबाउट 1.5 लीटर. बट इफ इट इज more than it's creating, it's a problem. So ADH means who is reducing the urine amount, right? ADH. So it is very necessary. Otherwise, entire water we will lose entire body water in the urine only. We will suffer with the dehydration. So ADH is very good hormone, antidiuretic is very good hormone who is reabsorbing the water. पानी को वापस absorb कर लेता है. So how to make the treatment plan for this? So now let's see here. So how we are making the treatment plan for this purpose, for this thing? Let's see here. Yeah. So this is the posterior pituitary. Let's see here. The posterior pituitary is controlled by DUMI. Here is the anterior pituitary, and this is the posterior pituitary. We can see here anterior pituitary and posterior, secreting oxytocin and ADH. Oxytocin and ADH, right? Fine. So in this way, how to activate? We have to activate by the DUMI. DUMI के माध्यम से activate करना. The master point is SI3 and the couple point is beta 62. For the male, we can work. You want to activate posterior pituitary. आप posterior pituitary को activate करना चाहते हैं. You want to increase the level of oxytocin. You want to increase the level of ADH. आप इनका लेवल बढ़ाना चाहते हैं. Maybe person is doing more urine, person urinating more. You want that person should urinate in limit. Why the person urinating more? So you want to increase the level of ADH. Or the person is having a lack of oxytocin, which is responsible for delivery. And even the breast milk is coming out by the oxytocin. Suppose you want to work on the posterior pituitary. You can do more study that what posterior pituitary is doing. Then SI3 tonification and urinary bladder 60 sedation. For the male, we can choose the master point on the left side. And for the female, we can choose the master point on the right side. So remember, SI3 tone and urinary bladder 60 sedation. Suppose we want to treat the female uterus. Female is having history that he's not having he's not having secretion of oxytocin. So not able to produce, not able to do normal delivery. Okay. So even she is not pregnant, during that time, we can balance the system by this protocol. अभी प्रेगनेंसी हुई नहीं है, अभी डिलीवरी की कोई बात ही नहीं है, अभी हम सिस्टम को बैलेंस करना चाहते हैं ताकि हार्मोन का सीक्रेशन समय पर हो, तो हम इस पॉइंट से ट्रीटमेंट दे सकते हैं. अल्टीमेटली वी कैन बैलेंस द posterior pituitary. If there is some weakness in the posterior pituitary, some disharmony in the posterior pituitary, we can add SI3 tonification and urinary bladder 62 sedation. हम ये 2 पॉइंट ऐड कर सकते हैं, राइट? तो इससे जब प्रेगनेंसी होगी उसके बाद नॉर्मल डिलीवरी होने की संभावना बढ़ जाएगी. There is some more chances because लेबर पेन विल स्टार्ट ऑन टाइम. लेबर पेन टाइम पर स्टार्ट हो जाएगा. ओके. नाउ इफ वी वांट टू मेक दिस प्रोटोकॉल मोर इफेक्टिव, अगर हम इसी को और ज्यादा इफेक्टिव बनाना चाहते हैं, वी वांट टू improve this protocol, we want to work this, we want to work for the female uterine function, then we can use SI3 tonification on the right, urinary bladder 62 sedation on the left. Then this circuit is complete. Now we are making cross circuit. Lung 7 tone and the kidney 6 sedate. This is a cross circuit, right? So this is a very good circuit, very wonderful circuit for the female if we want to balance the posterior pituitary. We want to bring all the problems. We want to balance all the issues which is connected with the uterus. There's a wonderful protocol for the uterus. If some female has removed the uterus, then also we are doing the treatment by this protocol. किसी फीमेल ने कहा कि मुझे घुटने में दर्द होता है, मुझे कमर में दर्द होता है, आई एम सफरिंग विद लो बैक पेन, नी पेन, and uterus has removed, we can apply this protocol. SI3 tonification on the right, urinary bladder 62 sedation on the left, lung 7 here, kidney 6 here. So it will be doing, ये पूरे खाली स्थान को भर देगा. It will be doing refilling of the hollow and empty area. So pain will disappear. And we can also use the DU3 point. It's a very simple protocol, but very much effective. SI3 tonification on the right, UV2 sedation on the left, lung 7 tonification on the left, kidney 6 sedation here, and DU3. So ultimately, we are enhancing the posterior pituitary as well as posterior pituitary is having connection with the entire back. हम जानते हैं कि DU मेरिडियन कहाँ होता है. DU मेरिडियन हमारे बैक साइड में होता है. DU मेरिडियन हमारी स्पाइन के ऊपर से ही जाता है. So ultimately, what we are discussing, ultimately we are seeing this. The posterior pituitary is connected with the governing vessel, Dumai, and having some connection with our back side of the body, our spine, neck. अगर हमें आगे कोई भी प्रॉब्लम हो, like we are suffering with the problem on the front side, like problem of the forehead, problem of the face, problem of the throat, problem of the chest, use Renmai. हम Renmai को use कर सकते. But if the problem on the back side, like problem of the neck pain, upper back pain, middle back pain, lower back pain, buttock pain, any problem which is on the back side, we can use this. Because the governing vessel means spine. Right? So it's clear. Now we are moving. We will also see here one more thing. Even for the male, अगर हम male को treatment करना चाहते हैं, so even some male is coming to you and having some disharmony in the posterior pituitary and having lower back pain, maybe lower back pain, right? So maybe any problem which is in the root of governing vessel. So even if you want to treat the male, अगर आप male को भी treat करना चाहते हैं, so this treatment protocol will balance the. So first what we have to do, SO3 tonification on the left and urinary bladder 62 sedation on the right. This is the primary protocol. The master point will be on the left and the couple point will be on the right. Then for the male, we are using kidney 3 and UV23 tone. They are both the point of kidney. Ultimately, we know the back part, the spine is having connection with the kidney also. And we will do the tonification of these points with the DU3 even method for male, female both. So remember this very, very effective protocol for the male and female. And we are using these protocol for any condition, which is if the person is having pain anywhere in the spine area. For the female, especially, we are using lung 7, the kidney 6, because they are having uterus. And uterus is the very important part in the female. Okay. So in this way, we have to understand this concept. तो अभी इनको क्विकली डिस्कस कर रहे हैं. इस कंसेप्ट को हम धीरे धीरे और गहराई से समझेंगे. Right now we are discussing quickly because our target is right now main target to understand the connection with the endocrine function. अभी हमारा मुख्य लक्ष्य यह नहीं है कि भाई हमने स्टमक 30 क्यों ले लिया, हमने ये पॉइंट क्यों ले लिया, kidney 3 UV23, why we are taking kidney 3 UV23. Right now our main The Renma is having connection with the anterior pituitary and Duma is having connection with the posterior pituitary gland. Right? Now the third and most important we'll discuss now. That is Chongmai. Chongmai or Chongmo. Chongmai and the Chong. So remember one thing, always we have to balance these three extraordinary vessels. हमें सबसे पहले हम जब भी हम इस बात को समझेंगे कि हमें सबसे पहले इन तीन पर काम करना होता है, we have to work on these three. Okay. So Chongmai is the very important. Chongmai. So Chongmai is having connection with the gonads and testes and ovary, and we know nowadays a big generation is having problem with the testes and ovary. एक big generation को testes and ovary की problems है, right? Chongmo. Chongmo को बोलते हैं the main function of Chongmo. Understand? See. So this is the main function of Chongmo is clearing the path, removing the blockage, clearing the path and removing the blockage. अगर आप इसका हिंदी में नेम देखेंगे तो आपको ऐसा ही दिखेगा, अवरोध निवारक, मीन्स द रिमूविंग द ऑब्स्टैकल, दैट द Chongmo. The master point will be spleen 4 and the couple point will be pericardium 6. The master point will be spleen 4 and the couple point will be pericardium 6, that is Chongmo. Here, the Chongmo is having connection with gonads. Gonads means testes and ovary.
Last time.
2-3 minutes. So Chongmo. Chongmo is having connection with the testes and ovary, right? Okay, now we'll continue the discussion tomorrow from here because okay. Actually, let's see how much. So quickly, I will tell you. Suppose some female is suffering with a polycystic ovary, Chongmo. Some female is having problem of hormones, Chongmo. So I would like to show you one image. Let's see this image. इस image को देखिए. So we can see here, in the male testes is secreting testosterone hormone, which is the male sex hormone. Suppose someone male is having some problem, maybe erectile dysfunction, maybe impotency, or maybe some hormonal problems, or maybe male developing the breast, or male is having not enough like mustache hair, like दाढ़ी मूछ के बाल नहीं. यानी if the male is suffering with any type of the hormonal problems or the female is having any type of the hormonal problem, maybe unwanted hair growth on the chin, maybe ovarian problem, the estrogen and the progesterone hormone are not good, so she is suffering with a menstrual dysfunction. If the female is having some menstrual problem, so male or female, if they suffer with any type of the genital hormone problems, then we will use Chongmo, and the meaning of Chongmo is spleen 4 and the pericardium 6. Right? So let's see here quickly. One minute. So let's see now. So for the male, we want to work on the testosterone hormone. We want to improve male sex hormone, spleen 4 on the left, which is the master point, and pericardium 6 sedate, which is the couple point for male. For the female, we can take spleen 4 as a master point and pericardium 6 as a couple point for the female. You want to work for the male or female, so we have to take spleen 4 and the pericardium 6 because testes and ovary having connection with the chongmo, right? So actually, we will be discussing more about this. First, I want to go through with all the endocrine glands, and I want to fix in a mind the connection testes, ovary with chongmo. So whenever we will discussing the detailed diagram of chongmo, that again and again you have to correlate. Okay, chongmo means testes ovary. Chong means testes ovary. So right now you be able to fix like Ranmai anterior pituitary, Dumai means due meridian posterior pituitary, and the chongmo is our testes and ovary, right? How we will treating the patient very effectively. I have seen the very wonderful results just by using the spleen 4 and the pericardium 6 in PCOD. हमने PCOD में बहुत ही अच्छे रिजल्ट देखे हैं केवल 2 पॉइंट्स के माध्यम से. They are creating wonderful effect. So we will keep discussing. Now the next class will be on Monday. Tomorrow I can take class for 30 minutes or Monday. Monday is good. Okay, so next class will be on Monday. Okay, so the link will be posted in the final group for the enrolled participants from Monday onwards. So thank you so much. This video I'll publish shortly for all of you. See you on Monday. If you have any questions in your mind related with the discussion we have done today, you can put in any group. आप जिस ग्रुप में उस ग्रुप में आप डाल सकते हैं because this concept is very important and I want that you should use it. One more information I want to tell you. Suppose you are using spleen 4 and pericardium 6. You can add a G cleft point, stomach 30, which is just shortly we are going to discuss because maybe this is very good information, so I want to pass right now. Spleen 4 pericardium 6 and stomach 30 for male. Spleen 4 pericardium 6, CV1 for female. Suppose today if you want to do the treatment for some patient, what do you do? Suppose female, spleen 4 pericardium 6 and CV1. For male, spleen 4 pericardium 6, stomach 30. क्लियर? अगर आप मेल का ट्रीटमेंट करना चाहते हैं, क्या कोई भी गोनेट्स का, उसको मानो किसी मेल को कोई भी हार्मोन की प्रॉब्लम हो रही है, टेस्टिकुलर प्रॉब्लम हो रही है, spleen 4 pericardium 6 and stomach 30. Stomach 30 even होगा, bilateral होगा. If you want to work on the female like menstrual pain, menstrual cramps, and irregular menstruation, whatever the problem with the menstruation or hormonal issues, spleen 4 pericardium 6 and CV1 bilateral. तो आपको ये प्रोटोकॉल ध्यान में रखना है और ये सब हम आगे डिस्कस करेंगे, लेकिन अभी मैं बता रहा हूँ कि because you are having today and tomorrow, you find any person having hormonal problem, please apply this protocol and share a feedback, right? Thank you so much. See you in the next class. You can apply in the original location as well as in the Sujog. Original location, it's depend on your expertise. See, everything is possible. But if you think that if it is not possible, then you can apply in the Sujog, right? Definitely, if stomach 30 is very easy to apply in the body. It's not a difficult one. I can discuss only step by step, right? Okay, now let's close now. See you in the next class. Thank you so much. Good night.